Many patients that require IV therapy face health complications resulting from intravenous infiltration. These complications can range from pain and swelling to blistering and tissue necrosis. There's a widespread dependence on periodic visual checks at the IV insertion site for possible complications, and this puts patients at a higher risk for undetected IV infiltration. Healthcare providers need a method to constantly monitor the IV insertion site and alert providers of possible IV infiltration in order to perform early intervention and prevent it from progressing to the point of severe complications. N.I.D.D, our non-optical IV infiltration detection device, ensures that patients experience proper IV treatment while healthcare providers are able to work more efficiently as they will no longer have to rely on time-consuming manual checks of the IV insertion site. N.I.D.D monitors temperature, bioimpedance, and strain levels at the IV site. To use the system, healthcare providers first attach all sensors to the patient. The temperature thermistor is taped directly below the IV site. The strain gauge is wrapped around the patient's forearm a few inches below the IV site. One bioimpedance skin electrode is placed on the upper arm and the other below the strain gauge on the forearm. The adjustable strap with all embedded wires coming from the sensors is placed around the patient's wrist.
So here we have the UI for N.I.D., and this is where the nurses or the doctors will start off once the IV is placed into desired site and they would like to monitor the IV for possible infiltration. They would go on here and then click Start Session. A new window will open where the nurse will be able to select what kind of sensitivity they're looking for in terms of the infiltration alarm. And this varies from low, medium, high. These can be set to clinically relevant percentages. We'll select medium. As soon as the calibration starts, the data will start taking in from all sensor modalities, kind of sensing what is the baseline for all these values while there's no infiltration going on. The calibration is a little sped up just for this demonstration. As soon as the calibration is done, the baseline temperature, strain, and bioimpedance will be shown on the right. And based on whether the nurse is satisfied with these values or not, they can either select recalibrate or they can start the detection session. So now we're in the detection phase of the software, and at this moment, all the sensors are taking in data from the IV infiltration site to monitor these temperature, strain, bioimpedance, which are all symptoms of which will change based off a possible IV infiltration event. And so here on the plots, we have a blue line and the red line and the green line. These solid lines indicate a moving average of the current data that's coming in, and then the dotted lines in the respective colors indicate the activation thresholds that were calculated previously. For temperature, it will decrease in the case of infiltration, strain will increase as it swells, and bioimpedance will decrease in the case of an infiltration. And so currently, this will be the front panel that nurses and doctors will be able to view as the IV therapy is continuing and the surgery is continuing, so they can constantly monitor the data and visualize the case of an IV infiltration.
In the event of an IV infiltration, the system will sound an alarm, alerting the nurse to check the site of the IV. When the provider selects Confirm Alarm, the system will cause 3 graphs to display the raw data from all 3 sensors for the entire session from start to finish, showing when the values cross the threshold.
So the 2 technical things that we're proud of for N.I.D. is one of them is integrating all 3 different sensor modalities and working with things that are recording in analog and also things that are outputting serial communication. And the other thing that we're proud of is having the alarm not only happen on the software end, but also making sure that the alarm and the lights happened on the hardware end of the device.
Moving forward, some things that we could do with N.I.D. include moving to a Bluetooth system in order to eliminate all these wires, which would be really good for the patient because then they wouldn't have to worry about dislodging the sensors while they're in the hospital, or just less for the doctors to have to worry about. In addition, we would like to have a less bulky attachment device for the system so that is more comfortable for the patient and more visually appealing. And finally, we would like to start clinical trials in order to determine the exact values for detection of infiltration for each of the sensors so we can have the clinically relevant